And very pleased to have in the studio with me Wendell Potter, former health insurance industry executive, the author of a couple of books, Deadly Spin and Nation on the Take. The new paperback edition of Nation on the Take is coming out February 7th, next week. That's great. And you've got a new project, Assume Nothing, Trust Tarbell. Crony Capitalism Controls America. Sign up and learn why that matters to you. This is tarbell.org. You can tweet, by the way, and also you can find out all about Wendell Potter at wendellpotter.com, and you can tweet him at Wendell Potter, 2 L's, 2 T's, Wendell Potter. Well, it's just at Wendell Potter, isn't it, your Twitter handle? Okay, right. So first of all, welcome back.
Thanks, Tom. Glad to be here.
Great having you with us, Wendell.
Thank you.
Tell us, Tarbell. What is Tarbell? Why that name? What are you doing here?
Well, I started this because I felt there was a big gap in journalism in this country. My last book, as you noted, is Nation on the Take. It's a book about all the money that is spent to control and influence elections and public policy and public opinion. I was a part of that, actually, in industry when I worked for the insurance industry. So I know it from that perspective as well, too. It's some work I used to do. And I want to help people understand the connection between all the money that's spent to influence public policy and our everyday lives. I want them to understand why Verizon, for example, spends so much money to influence public policy on Capitol Hill or in their state legislatures, and what that means to them in their daily lives.
Why do they?
Why do they spend all that much money?
Yeah.
It is to enhance shareholder value. Most of these are publicly traded companies. They work individually.
Well, that sounds rather benign, you know. Oh, we just want to enhance shareholder value.
Sounds very benign. Yeah,
but what's the reality behind it that's less than benign?
The reality, it is a very benign statement. It's sounding that way, but that means that the people who are really benefiting are the shareholders, the people who own big chunks of stock of these publicly traded companies. And that is the allegiance of these CEOs, like the people I used to work with and work for. It is not their customers, and it is to make as much profit, to generate as much revenue that can be converted to profits.
So a health insurance company like the one that you used to be a senior executive with, their goal is not to make sure that everybody who has a policy with them gets the best coverage or gets their vaccines or their surgery or whatever. Their actual first mission is to make as much money as possible.
Exactly. And it is why you're seeing a lot of the companies exit the Obamacare exchanges, for example, because they don't have a commitment to insure people. In fact, the term insurance company is not really appropriate anymore because they shun as much risk as possible. Their ideal customer is a big self-insured employer, and that employer is actually providing the insurance, taking on the risk, and they're just providing the services. So they don't want to help Obamacare succeed. They don't have any incentive other than to make sure that there's no book of business within the company that is not meeting shareholders' expectations.
Right. So thing number one here, or the first thing here, is that, and not to rip off Chris Hayes, is that you'd like people to check out tarbell.org,
right.
TARBELL.org, and participate in helping launch this new media platform that's going to basically out corporate greed, for lack of a better phrase.
That's a good way to put it, and to help people understand why they should care and why they should get engaged. We have a dual objective of helping to get people organized, to understand how they can get involved and the importance of that.
So why the name Tarbell?
Tarbell is named after Ida Minerva Tarbell, one of the most important journalists in American history. Few people know about her now. She
was late 19th century.
Exactly, in the early 20th century, and her journalism led to some of the most important antitrust laws in the country and campaign finance laws during the Teddy Roosevelt administration. She and her reporting actually led to the breakup of the huge Standard Oil conglomerate that John D. Rockefeller had formed, and just incredibly important investigative reporting. And she was one of the country's first. She was pioneering journalism in many different ways. First as an investigative reporter, but as a woman reporter.
Yeah, remarkable. So you want to go down that road, and that's
I'm going to do her right.
You're taking on a big project here.
Yeah.
So, meanwhile, Deadly Spin and Nation on the Take, your other books, and of course, you worked in the health insurance industry for years and years. What's your take on what the Republicans, given that basically they control the government? I mean, they've got the House, they've got the Senate, they've got the Supreme Court, they've got, or they will, soon in a big way, and complete with the guy who helped author one of the Hobby Lobby decisions in the 10th Circuit.
Right.
What are they going to do about health care? I mean, they were all Sturm and Drang about, repealing Obamacare. Because, Fox News and right-wing hate radio had so convinced Americans that Obamacare was some sort of destructive socialist plot, evil, terrible thing. I doubt most people could tell you exactly why it's an evil, terrible thing, but they just know it because they heard it on Rush Limbaugh or they saw it on Fox News. So the Republicans now are in this bind, right? They because Obamacare was the Republican alternative, wasn't it? I mean, isn't this what Richard Nixon proposed in '72? What the Heritage Foundation cleaned up and rolled out in '86?
Exactly. What and again in '92?
Yeah, and then what Mitt Romney put into place in 2000 in Massachusetts, thinking that in 2004 he'd run for president on the success of Romneycare.
That's right.
And so this was the Republican alternative all along. President Obama put it into place. Why didn't the Republicans say, "Hey, finally, thanks for coming around to our side"?
Because they saw it as a political tool, and they were right. They used it, and it helped them win elections. They convinced a lot of people that it was the worst thing ever. And it was complex. The Democrats, I fought them because the Democrats did an incredibly lousy job of explaining the legislation. It's complex. It's not an easy thing to do. But the Obama administration and congressional Democrats didn't really own it after they passed it. And as a consequence, the Republicans were able to define it. Now, to your point, they're in a dilemma. There is the expectation that they have something to replace it with, but they don't have nothing.
Right. And this there was they got nothing. There was a recording, a secret recording of a group of Republicans meeting House
Philadelphia, exactly.
And they were like, "What are we going to do?"
Exactly. Right? It didn't surprise me a bit. It's interesting that the recording exists because it is the evidence of what I've been writing about. They don't have anything that is planned. 7 years after the law was passed, they've been demeaning this and saying that it needed to be replaced. You would think in that period of time they would have come up with a plan, but they haven't. There's no consensus, and there's no expectation that what they come up with will leave us in better shape. And in fact, it's more than likely that we'll go back to the dark days before the Affordable Care Act.
Trump has said he wants everybody. Did he say be covered or have access?
He used the term. He said beautifully covered. That came out of his mouth in a meeting with.
Coverage is different than access.
Exactly.
Right? Access means that you can go to the nearest ER.
That's the term that I think they're trying to shift to now. That's they're masters, and I don't mean to beat up on the Republicans. This is just
free.
It's what happens in politics. But they in particular are really good at messaging and the use of language, and so they're shifting the terminology to say access. And you're right; it could be we have access to the emergency room, or you have access to a doctor if you've got the money to go see that doctor.
Right. So access and coverage are two completely different things.
Absolutely, two very different things.
Yeah. So how do you see this resolving? I mean, is it conceivable that Trump and his desire to be loved by everybody could actually embrace a single-payer system and blow up the Republican Party, or is it inconceivable? Is he going to have to do the Paul Ryan, okay, we're gonna cut this thing to shreds routine, or face impeachment by his own party?
Yeah. It remains to be seen. He is, in fact, as you know, as in the past, has said positive things about the Canadian and Scottish system.
Yeah, he supported single-payer health care. I mean, it's been a decade since he's made any public pronouncements on it.
And then in 2015, he was saying that the Canadian system works well for the Canadians. And I doubt, though, that he will embrace single-payer. I don't think he will have that kind of support on Capitol Hill. We know he won't. Yeah. But he's in a dilemma because he has promised something that I don't think even the Republican PR machine can. I don't think they can come up with the terms to make people think that they've done something better.
This is where Bernie and the Republicans are doing everything they can to say, hey, you said
right,
everybody gets covered, you know,
That's
and
right.
you said you're not going to cut Social. You're not going to let the Republicans cut Social Security, Medicare, and Medicaid.
Yeah.
Although Paul Ryan is building that budget as we speak.
Right.
Anyhow, Wendell Potter, one of the great ones. Wendell Potter. You can tweet at Wendell Potter, wendellpotter.com, and Tarbell, TARBELL.org. Thank you.
Yes, thank you very much, Tom. Take care.